working in this field for quite some time, and you're one of our resident experts, and we want to explore that a little bit this time. First of all, how did you get involved in preventable injury prevention?
Well, I'm an epidemiologist by training. I have a master's in public health from UCLA, and when I began with the Department of Health Services, I did infectious disease epidemiology, primarily measles and vaccine-preventable diseases. But epidemiologists look at the data, and I continued to look at the data, and it became very clear to me that what children and young people were dying of and going to the hospital for in Los Angeles were not infectious diseases. It was injuries, both intentional and unintentional. And just to sort of edify for people, you and I know what that means, but unintentional injuries are the things that most people call accidents. So it's drowning and car crashes and falls and fires. And the intentional injuries are the ones we spoke about before, which are those injuries caused by violence.
Now, we're taping this in the middle of summer, the height of summer. Summer is nationwide the most dangerous time of year. You know, something like 43% of the injuries to children happen during the summer, May to August. What are the things that we should be telling parents about, telling families about, right off the bat, just seasonal? There's obviously a lot of other issues, but what should we be telling people about that they can do today to make their life a little safer with their kids?
Well, first of all, because it's summer and because we've just had suddenly 5 drownings of young people, the first thing that comes to mind in summer is, first of all, drowning prevention. Almost all drownings are preventable, really. One of the strategies for toddler drownings, which up until recently have been our most high-risk group of drowning, is you've got to have a barrier. If you've got a pool in your house, you've got to have a barrier between that house and that pool, or alarms, something that lets you know that when a child gets out. Because most kids drown in the backyard swimming pool at their own home or at the home of a friend or relative. And in about 1995, we passed a law in California that requires a barrier between the house and the pool on all new pools, or an alarm system. And but most pools are not new pools. So if you've got young children particularly, we really do urge you to do layers of protection. Put a barrier between that house and that pool. Make sure that you've got a phone by the pool, inside your pool area. Make sure you've got a long hook. If somebody falls in, you can get them out. And for heaven's sakes, no child CPR.
Well, I can remember when that law passed, and I also can remember when groups were working with building and safety officials to encourage people to use that. And so often you'd say, well, you're supposed to have a barrier all the way around the pool. And they say, well, I do. I have 3 fences in my house, and no kid can get in.
Well, that's right. No kid can get in from the outside, but kids, as I said, don't drown in somebody else's house. The most common scenario is a child who is last seen in the house and just gets out the door and gets into that pool. And it's the backyard swimming pool. And with children, it's a silent event. Children don't thrash and scream when they get into water and get into trouble. It's a very silent thing. They just go into the water, and we've talked to near drowners who've said, and we've said to them, were you frightened? What did it feel like? And they said, no, I just went into the water and went to sleep. And that's what it's like for a small child. So it's silent. It happens in a very few minutes, and it's, even if it's not fatal, there can be some terrible, terrible brain damage from a near drowning incident.
Well, and it's not just pools. I mean, there's so many other hazards around the house that people just don't think of.
That's true. I mean, there's the large buckets. Kids can drown in that. It just takes a few inches of water, really. Bathtub drownings are the other issue for very young children. And then toilet bowls. Children drown in toilet bowls. They drown in almost any body of water, or can. And so we really do, aside from terrific supervision, which you need to do. And when we say supervision and keep your eye on your child, we mean maintain eye contact. It's different than just, sort of being outside and adults are outside around the pool too, somebody needs to have their eyes on children around water.
Well, the lifeguards have a program, and I think you can get it at LA County Lifeguards, as a matter of fact, where they have a paddle that you take it off, you hand it to the other person. There's no, well, I'll watch them for a while. No, that's all you're doing. I'll go in and mingle with the guests. I'll go do whatever I'm going to do. You're watching the child. That's all you're doing. And because you're right, in 10 seconds, in the time it takes for you to go get a towel, the child can go under the water.
And that's right, and they can go under the water, and depending how far you have to go for that towel, they can really have some problems. It's funny you should mention the paddles. That's the WATCH program, which is a program of the Department of Health Services and the Fire Department. It's a joint program and project that we've put together to make sure somebody's always got their eyes on a child.
Well, look at the success of your program. It's come back to you where somebody's actually telling you about it. That's very good.
That's wonderful. And then the other thing we're a little more concerned about this year is the scooters. Kids they're the ubiquitous scooters everybody sees every place. Now, we really, there have not been fatalities, but kids do get hurt. If you're going to have a child on a scooter, we suggest they have an all-purpose helmet on. And most of those injuries seem to be occurring either to the back of the head and wrists and ankles. So we also suggest that if your children are riding scooters, that you make sure they've got wrist guards and ankle guards on.
And helmets can
helmets,
be gotten
absolutely.
so inexpensively.
$4 or $5 now.
Right.
You can get an ASTM-approved helmet for your child, and we really do. Bicycles, tricycles, head injuries can be so deadly, and people don't think about it, and it's so easy to prevent with a helmet.
And if you start the child young, where it's a matter of course, it's so much easier. That's kind of the same thing with safety seats, which we've seen over the years.
Exactly. And the other thing about helmets is if you ride bicycle with your child, you ought to have a helmet on too. It's the law for children under 18, but we think adults should have helmets on as well.
Well, it's the old line about, well, it messes up my hair, and it's like, yeah, well, so does a serious head injury,
Yeah, it messes up your head a lot more than having your hair look messy.
So speaking of children and the scooters, back up a little bit. One of the biggest things that kids face are motor vehicle.
Yeah.
We can talk a little bit later about children left in cars, but there's still it's still so difficult to get parents religiously using the car seats for the children. And
using them correctly is the other issue. Something like 85% of the children who have been observed in car seats are not in them appropriately. They're not buckled in right. The seat isn't fit into the car exactly the way it should be. So we think that everybody should be in a car seat, obviously. There's just recently been a new law passed. Up until this year, if a child was 4 years old or 40 pounds, they no longer needed to be in a car seat. That's been increased to 6 years old or 60 pounds. The fact of the matter is that we really would like to see it 8 years old or 80 pounds at least. But they need, if they're bigger, they can be in a booster seat. The fact is that no child should ride without being in an appropriate car seat and with a 5-point harness, particularly on the younger children. And for those who can't afford them, we do have programs that will give you a voucher so you can go get a car seat that fits your car. And just to remind you, the fine for riding around with an unbuckled child is very expensive. It begins at $100.
Well, and besides that, just children being top heavy, they fly head first. They're just absolutely helpless, and it is such a reasonable price and such an important habit that there is no excuse. And as you say, if it's financial, there's places to get help, and so much of it is, well, they were only out of the seat for a second.
That's all it takes.
They were crying, so I picked her up. there are so many ways that people can get them. The bad part is they are very difficult to install properly. But